Hepatitis B became a reportable infection in the United States in 1966. Since then, the reported cases increased annually, reaching to 10,000, 15,000, and then over 20,000 cases in every 100,000 population for a decade. In 1981, FDA approved its first hepatitis B vaccine, which was first issued in the following year in the United States. As indicated in this chart, the number of cases continued rising to reach its peak until the year of 1991. What makes 1991 a remarkable year? 1991 is the year that the universal vaccination for infants was recommended. Since then, in addition to available vaccines, we also have a better strategy of utilizing the vaccine to maximize its protection for us all. Today, let's discuss hepatitis B vaccine. Here are the objectives that I wish to achieve in this lecture. The hepatitis B virus was first identified in 1965 by a physician, Barack Blumberg, who won the Nobel Prize for discovering this Australia antigen. Later, the microbiologist Irvine Millman worked with Dr. Blumberg. Together, they developed a test to screen the blood for this virus. In 1971, the risk of getting hepatitis B infection through blood transfusion was greatly decreased because the blood banks adopted this screening method. In 1975, Dr. Blumberg and his partner, the microbiologist Millman, developed the world's first hepatitis B vaccine, which is the heat-treated virus. The first commercialized hepatitis B vaccine was approved by FDA in 1981. We mentioned that earlier. However, this plasma-derived inactivated viral vaccine was discontinued in 1990. The reason for discontinuing is attributed to the emerging of the second generation of DNA recombinant hepatitis B vaccine, which happened in 1986. Since then, the approved hepatitis B vaccines in the United States have been providing a much safer yet effective result. Because these vaccines are synthetically prepared, getting hepatitis B infection after vaccination is not likely. Hepatitis B vaccination is recommended for everyone. Some people are at higher risk to contracting hepatitis B because of the increasing risk for exposure. Here, we have a list of people considered at high-risk populations. This is identified by ACIP. There are two immunobiologics used to fight against hepatitis B infections: vaccine and immunoglobulin. While vaccination remains the backbone for protection against hepatitis B infection, immunoglobulin complements to the protection provided by vaccines. The artificially acquired passive immunity provided by immunoglobulin is temporary, lasts up to 3 to 6 months. To the contrary, vaccination provides artificially acquired active immunity. In case of active immunity, the anti-hepatitis B surface antigen can still be detected 30 years after completion of the series. This means the client who needs immunoglobulin should also receive vaccination for a full protection. There are two hepatitis B immunoglobulin products licensed in the United States, HepaGam B and Nabi-HB. Both are derived from plasma with high concentration of antibody to hepatitis B surface antigen. The plasma is screened for human immunodeficiency virus, hepatitis B virus, and hepatitis C virus, and the negative readings are obtained before the immunoglobulin can be used. No doubt that the hepatitis B vaccine provides the essential protection. However, in certain situations, immunoglobulin provides the immediate defense that one needs. It is given to newborns whose mothers are hepatitis B infected. meaning the mother's blood test shows positive reading for hepatitis B surface antigen. If the mother's status of infection is unknown, the newborn is treated as the mother is infected. Immunoglobulin also serves as a prophylaxis to protect the client after exposure to hepatitis B. For example, healthcare workers after a needle stick incident or a sexual partner of an hepatitis B patient. In both situations, hepatitis B immunoglobulin is given via intramuscular route at separate limbs simultaneously with hepatitis B vaccination. In the first case, immunoglobulin is administered within 12 hours after birth. And in the second situation, a blood sample is collected for baseline data. Then the immunoglobulin is administered as soon as possible, preferably within 7 days. Generally speaking, hepatitis B vaccination is a series of either 3 or 4 doses of vaccines, preferably starting at birth or as soon as possible. The series of 3-dose or 4-dose vaccination is determined by factors concerning the types of vaccines and the receiver's age as well as their medical conditions. First of all, types of vaccines. Hepatitis B vaccine can be either a single antigen or a combination vaccine. Only the single antigen vaccine is licensed for use at birth. There are 2 single antigen hepatitis B vaccines, Engerix B and Recambivix HB. When both can be used as a 3-dose series initiating at birth, Engerix B is licensed for all age groups as a 4-dose series as well. So how are the 3 and 4-dose series scheduled? This is the timeline marked by months for both newborns and others. 3-dose series is given at 0, 1, or 2 months, then 6 months. The time you get the initial dose is 0 month, and for newborn it will be at birth. Engerix B can be administered as a 4-dose series, and it is given at 0, 1, and then 2 to 3 months, and then last dose at 6 months after the initial dose. Now let's discuss who are the candidates for the 3-dose series of hepatitis B vaccination. For the newborn, whose birth weight is 2,000 grams or more, regardless of the mother's status of serologic markers, and the newborn whose birth weight is less than 2,000 grams and the mother's hepatitis B surface antigen reading is negative. For these 2 newborns, they can start a series of 3-dose hepatitis B vaccination and is initiated at less than 12 hours after birth, second dose at 1 to 2 months of age, and then the last dose at 6 months of age. This is when you use single antigen vaccine for the entire series. Now, the only difference between these 2 newborns is that the lower birth weight newborn should receive his first vaccination at age 1 month or at the time of discharge from the hospital. Children and adolescents are also candidates for a 3-dose series vaccination using children or adolescent formulation. Single antigen vaccine can also be given to newborn as a 4-dose series if the newborn meets the following criteria. Birth weight is less than 2,000 grams, and the mothers are either infected with hepatitis B or her infection status is unknown. There are pediatric and adult formulations for Recambivix. Children's Recambivix is a 3-dose series vaccination, and the adult formulation can be given to adolescents aged 11 to 15 years as a 2-dose series. Now, the 2-dose series vaccination is given at 0 month, and then the second dose at 4 to 6 months. There is this one condition with this series. Children who receiving the 2-dose series should complete the entire series before turning age 15 years. If the adolescent turns 15 when it is time to receive the second dose, then the series should be extended to a 3-dose series using the pediatric formula for both the second and the third doses. Now we're going to move on to the combination vaccines. The first combination vaccine on the list is Twinix. There are 2 antigens in the vaccine. hepatitis A, and hepatitis B. This vaccine is licensed for people who are at least 18 years of age, and it is given prior to traveling to regions within where the risk of exposure to these viruses are high. Trinix is administered as a 3-dose series. The first dose is counted as 0 month, we mentioned that before. Second dose should be given 7 to 21 days after the first dose. Then the third and final dose is administered at 12 months after the initial dose. The second combination vaccine is Pediatrix. This vaccine contains DTaP, IPV, and Hep B. It is licensed for children aged 6 weeks to 6 years. So the first hepatitis B dose is a single antigen vaccine at 0, and then followed by the combination vaccine at 2, 4, and 6 months of age. This timeline, it actually is consistent with the infant's well baby checkup schedule and the vaccination for DTaP, IPV, and Hep. However, we need to mind that the last dose of hepatitis B vaccination should be administered after age 24 weeks. In most cases, this is not a concern. However, some children take accelerated schedule for pertussis vaccination, which is given in a 4-week interval. In such a case, if the fourth dose of Pediatrix is administered before age 24 weeks, the vaccination for hepatitis B is not considered completed. The last combination vaccine is Vaxilis. Features of Vaxilis is pretty much the same as Pediatrix, except 2 things. 1. Vaxilis is indicated for children aged 6 weeks to 4 years. And in addition to all antigens that you have in Pediatrix, Vaxilis also contains Hep. In short, when using combination vaccine for hepatitis B prevention, a 4-dose series should be administered. And for newborn, the initial dose at birth would be a single antigen vaccine and followed by the combination vaccine. Just a reminder. A quick review here for 4-dose series. In addition to the combination vaccine, the other 2 4-dose series of hepatitis B vaccines are Engerix, one of the single antigen vaccine, which is licensed to use for any age groups as a 4-dose series. After the initial dose, the subsequent doses are given at 1, 2, and 12 months. Also, the newborn whose birth weight is less than 2,000 grams and the mother is either positive or unknown to hepatitis B infection, this newborn should receive the 4-dose series of single antigen vaccine, or they can initiate vaccination with a single antigen vaccine and then follow through with the combination vaccines. The most experienced adverse effects when receiving a hepatitis B vaccine are local reactions to the injection site, with mild, self-limiting inflammation. Some might experience mild systemic reactions, including fever and headache. Mild the allergy reactions. Patients with history of allergy to either the ingredient of the vaccine or yeast are contraindicated with hepatitis B vaccination. Severe adverse effects are not common. Accordingly, incidents of severe side effects are associated with receiving multiple vaccines at the same time. Fever, injection site erythema, and vomiting are the most commonly reported adverse effects. Allergy is the only contraindication to receiving hepatitis B vaccine. The licensed hepatitis B vaccine in the United States are synthetic and biologically engineered using yeast. Therefore, allergy to yeast is a contraindication. For people who are allergic to any component that is included in the combination vaccine, the single antigen vaccine is the alternative. Here we list 2 special cases, pregnancy and post-exposure. All pregnant women are screened for hepatitis B during first trimester. All hepatitis B antigen-positive pregnant women should be referred to their jurisdiction's perinatal hepatitis B prevention program for case management, and they should be tested for viral load. Prenatal antiviral therapy is initiated at 28 to 32 weeks gestation if maternal viral load is more than 200,000 IU per milliliter. Patient education to pregnant women here should be emphasized on prevention of their newborn's vaccination and immunoglobulin needs. Encourage the mothers to have their babies complete the hepatitis B series. The pregnant women who are unvaccinated and engaging in high-risk behaviors during pregnancy should be vaccinated. High-risk behaviors include having more than one sexual partners during the previous 6 months, history of sexually transmitted infection, recently using injection drugs, or having had a hepatitis B surface antigen positive partner. Depending on individuals' vaccination status and the exposed source, different vaccination schedules are recommended. A single dose of hepatitis B vaccine is recommended if the patient has a document proved that a previous vaccination was completed. Should the person be in the series of hepatitis B vaccination but not completed that yet, a dose of hepatitis B immunoglobulin is administered immediately, and the person should complete the vaccination series as originally planned. If the person is unvaccinated, hepatitis B immunoglobulin and hepatitis B vaccine should be administered simultaneously at different limbs within 24 hours of exposure or as soon as possible. The person should also complete the series of vaccination according to the age. This is when we know that the person is exposed to a positive hepatitis B surface antigen source. Now, what if the exposure is to an unknown status of hepatitis B surface antigen? In that case, if the person has a written proof for completed series in the past, there is no treatment required. If the person is in the middle of a hepatitis B series, then complete the series as scheduled. In third situation, if the person is never vaccinated with a hepatitis B vaccine, then hepatitis B vaccine should be administered as soon as possible within 24 hours preferably. Also, the person should complete the series accordingly. For healthy people who initiated hepatitis B vaccine at more than 6 months of age, the protection lasts at least for 30 years. Extra dose of hepatitis B vaccine or repeating the entire series of vaccine does not cause any harm, although it is not usually recommended if the person is immunocompetent. Post-vaccination testing can provide information to guide treatment, and people who need post-vaccine titer test include the following: infant born to a hepatitis B surface antigen positive mom, a healthcare worker and public safety worker exposed to hepatitis B, patient who's on chronic hemodialysis, or patient who has HIV infection and other immunocompromised patients. These patients need post-vaccine testing for titer. We're going to talk about infants specifically here. Infants who are born to a hepatitis B surface antigen positive mom will receive both hepatitis B vaccine and immunoglobulin at birth. Their post-vaccination testing should be performed 1 to 2 months after completing the third dose or more, and after 9 months of age. You see, if you test these children too early, the test result is not going to be valid. Remember that the passive immunity provided by immunoglobulin can last up to 6 months. Booster dose is not usually recommended, especially to people who are with normal immune system. Although the anti-hepatitis B surface antigen level does decline over time after vaccination, it is found that immunocompetent people still get protection even if the level is dropped below less than 10 milli-IU per milliliter. Now, 10 milli-IU per milliliter is the preferred level for protection. Some people might benefit, though, from a booster dose. For example, when the annual titer reading indicates a below 10 milli-IU per milliliter of antibody to hepatitis B surface antigen, a booster dose vaccine is recommended to the hemodialysis patients. The need for booster doses is not established for those who are immunocompromised. Thank you for taking this lecture.